Rachel,
Yeah.
people get confused, and with reason, right? About the difference between Alzheimer's versus dementia. We hear people, even professionals in the dementia care space, lump these two together and say Alzheimer's and dementia. But really quick, we just want to teach everybody what the difference is. And it all starts with an umbrella.
Yeah. So the phrase dementia and Alzheimer's is kind of a misnomer. It would be similar to saying cancer and skin cancer, which would make you say, what? Right? Of course, you can have a couple different types of cancer. Same thing here. You can have a few different types of dementia, but saying dementia and Alzheimer's is really confusing. So dementia is an umbrella term for over 100 different causes of cognitive loss. Alzheimer's disease is the most common cause of dementia. And I think that it gets lumped together in that way because people feel like they know what Alzheimer's is, even if they don't. They go, okay, well, it has something to do with short-term memory. Got it. And so it just becomes a keyword almost. I've even had people say, well, we make sure we say Alzheimer's and dementia on our website for SEO. And I'm like, okay, but there has to be a better way to do that than putting it in one sentence because that is confusing for people. And I think leads families astray when they're looking for a diagnosis for a loved one.
Yeah, and oftentimes folks living with dementia don't have a particular diagnosis beyond just dementia. So that can make things extra confusing.
Right. If they haven't been to a, geriatrician or a center that specializes, like a hospital system that specializes in diagnosing someone with a specific cause of cognitive impairment, typically their, medical paperwork will say dementia. Dementia is not really, yes, it's a diagnosis, but it's essentially equivalent, again, to writing cancer. It's like, well, what type of dementia, what type of cancer? And without that information, you're left with holes in the story that sometimes become challenging when we're talking about finding a treatment, plan, or trying to troubleshoot someone's quote unquote behavioral challenges. We're left asking questions like, well, what's the cause of their dementia? And the answer we often get is, we don't know.
What I find really interesting, though, that you're able to do, and even though you're not a doctor, you're obviously a dementia expert, is to sort of, when you talk about the markers of certain specific dementias, for example, I remember, and we've talked about this before online, but I remember when they announced that Bruce Willis was experiencing aphasia, and you immediately were like, oh, he probably has frontotemporal dementia.
Yeah.
So can you talk a little bit about maybe what some of the markers of Alzheimer's might be, so that would sort of be a clue for families as they're preparing to get their loved one formally diagnosed?
Alzheimer's specifically is really what you think about when you think about dementia. It really is that short-term memory loss. I've met many, many people living with Alzheimer's disease who physically look and seem and physically are quite well off. They're very ambulatory in early stages and seem fine. Other than that short-term memory is really the first thing that you're going to notice with someone with Alzheimer's specific dementia. That's going to be the first main thing. And of course, there are cascades of other issues that come in, but that short-term memory is the big first thing.
My grandmother, Lucy, she was never formally diagnosed with whatever kind of dementia she had. She had dementia for sure. But one of my favorite stories I love to tell about her and her short-term memory loss, although very sad and difficult as, her being my loved one living with dementia, difficult to see her go through. I love telling this story that I would go and see her with my now husband, and she would say, "Wow," to me, "You're so beautiful, honey," and then turn to my husband and say, "Isn't she just so beautiful?" And my husband would say, "Yes," and then 2 minutes would go by and she would just say, "Wow, honey, you're so beautiful. Isn't she beautiful?" I was like, I would always leave a little bit perked
Yeah, you
up,
feel great.
a little pep in my step.
You've heard it like 10 times.
Yeah. So I wonder, if she did have Alzheimer's because of that.
Probably.
Yeah.
Yeah, probably.
Well, thank you so much, Rachel. Now we've told everybody a little bit about how Alzheimer's relates to dementia and how dementia is actually an umbrella term.
That's right.
Thanks all.